Hi. So unlike the other speakers who maybe put in the balloons, I've been a medicine watcher, kind of watching this evolve as a bariatric surgeon. I definitely have a conflict of interest, and so I want to spend a second on that. I've never really given a talk where I actually had a really strong conflict of interest, and I probably do on this talk. The way it started was a few years back. I had two medical students rotate on my bariatric surgery service from Harvard Med School, and they were watching us putting in bands and bypasses and sleeves and said, can we do something a little better? And they were very interested in the idea of trying to achieve satiety and weight loss other ways, and did a lot of research on this, came up with several designs, and ultimately what they wanted to do was build a better balloon. And so many of the doctors in the hospitals really look at these guys as thought leaders, and we've invested in them. So today I really want to keep what I know to two data points. One is one paper that was published in obesity surgery, and second, a presentation by one of the gastroenterologists who's also an investor in this project last year at Obesity Week. So this is the balloon by Allurion, and like the balloon you just saw before, it's attached to a tube and it's a capsule and you swallow it. And just like the previous balloons, it's a space-occupying, soft object. So when you look at it, you kind of think, well, we should be able to achieve similar results with the added benefit of a pill that you swallow. And what I'll show you here is the technology that means that not only do you not have to put an endoscope on the front end to put it in, but you also don't need an endoscope to take it out on the back end. And that's pretty cool. So again, you have the swallowing of the capsule is attached to a very small thread, and this allows the injection of saline. Now the balloon itself has several features. There's a seal that shuts off after delivery of the catheter. So you pull out the catheter and it closes. The balloon itself is very, very thin. And what that means is when it does collapse, it just passes right through. And there's a release valve that allows that to happen after 4 months, which is the kind of key to making this thing release and pass. So what are the advantages? Well, we kind of talked about them. There's no anesthesia or sedation on the front end. We don't have the endoscopy. The gastric complications that we think are less because the balloon is thinner. I think that still needs to be proved, but it makes sense. There's no rough edges, as mentioned earlier. An intestinal obstruction problem, which would be a very serious problem, goes down dramatically when you have something that can make the curves and come out at the end. So the first paper that's been published, and the only one on this product right now, just had 8 patients. They followed patients for 6 weeks. The fill was approximately 450 cc's, followed up at 2 months. 6 out of 8 of those lasted the 6 weeks. And one that came out earlier was decompressed and was removed, and another one was electively punctured and removed. So it's not that you would never have to do endoscopy, it's going to be much rarer. And in that patient population, there was a 12% excess weight loss, or 2.5 kilograms. Now, since that paper that was published, there's been a clinical trial, and that's grown. But if I go back to the data that's been previously studied, I'll share that with you today. Again, the concept of the study was how difficult is it to swallow these? Does it go into the right position if we look at it on imaging? How is that fill working? Are they passing? And here you can see images by ultrasound and by X-ray of the balloon. In this multi-study trial, what they wanted to do was follow patients for 4 months and try as best they could to tease out some of the metabolic parameters as presented in the previous papers. So I'm sharing with you the results that were presented formally a year ago of 34 patients. The age was 42, BMI of 34. And the sites this was done is in Greece and Czechoslovakia. There were 34 enrolled, 1 aborted, 33 deployed, 31 emptied and passed. Key to this is the serious complications. Were there any deaths? No. Were there any serious adverse effects? Really no. The most serious things, as mentioned in the other balloons talked about, was nausea, vomiting, and abdominal cramps. key thing is how long it take and how much technology was required. Well, all the devices in this 34, as we gained experience, did not require endoscopy or anesthesia. The time to fill was under 10 minutes. The time to deploy was under 15 minutes. So this is something that all of a sudden you don't need to schedule an endoscopy suite. It's now something we can at least conceive of doing in a bariatric surgeon's office. 13 balloons were recovered. I guess everyone didn't sort through them and find them, but 4 of them did come up by vomiting, so that may also occur. So what did we learn? Well, there's a small group of patients, but there seems to be good weight loss. The BMI decreased by 3.4. The waist circumference decreased. There was a 37% excess weight loss, which I think is comparable to the data we saw with the other products that used all this extra technology. And as you lose weight, it's no surprise that some of the metabolic parameters also will improve. Now, when we look at quality of life with weight loss, we know that also improves. So what it says is even with 34% excess body weight, you do see quality of life improvements in our patient populations. Now, earlier, one of the talks presented that 60% of folks would do it again. If you get rid of all that endoscopy and anesthesia, it's not a surprise that more people might like to do the procedure. And in this survey, we found that over 80% would recommend it for a friend. And again, over nearly, 90% would do it again if they needed to lose some more weight. So I think from the patient point of view, it's not that they don't have the nausea and vomiting, but if you make it a little easier to swallow and pass, it's more likely they'd recommend it or do it themselves again. Again, we said nausea and vomiting can be a problem, but it looks like folks are learning about using multimodalities to really make a difference, and with combined therapy, really the amount of vomiting seems to be much less. So, early data, but if you think about the design, it makes sense. It's a procedureless procedure in that you think about there's no endoscopy, no anesthesia, it can be passed. And I still think there's future works, and I have no doubt that these Harvard medical students will continue to make new designs that will make good products even better. We look forward to bigger trials and appreciate the opportunity to speak.